Hey guys, welcome back to my channel. It's me, Stephanie, and I am here to talk to you guys once again about some more occupational therapy stuff. So I just want to say thank you for tuning in. So anyway, tonight we're going to talk about someone left a message about wanting to know about like the practice areas and specialty areas for OTA. Okay, so let's talk about the practice areas first. Some of the areas that you will find, which I'm gonna focus, miss, is OT and coders, but I'm gonna focus more on OT assistant because that's what I am. So a lot of the areas that OTAs and OTs work are, you can work in a hospital, you can work in a home health setting. And home health is when you go out to the homes and you treat the patient in their homes. Then there's pediatric clinics, which you go to like it's like an outpatient clinic that some of them specialize in working with children. Some may see children and adults. So you can work in pediatric clinics, and then you also can do, some pediatric clinics may do early intervention services. If you do early intervention services, that covers children ages birth to 3. So you'll go to their homes or to like child care centers or daycare, different places to work with the child. Mainly, it's supposed to be more like a home type setting, either in their homes or in some kind of, like, if they're in a daycare, then you go to the daycare and see them there, if you're doing early intervention. Also, there's outpatient clinics where people who had surgeries, and they didn't want to go to a nursing home, they have like outpatient clinics in the areas where they could just go there and get their therapy instead of going to like a inpatient facility like a hospital or a nursing home, something like that. There's like clinics that people that they can just go there and get their therapy services. So those are outpatient clinics. Then there's mental health facilities, mental health hospitals too, because I did my training, and when I was in school, I went to a psychiatric hospital here in North Carolina, one of the psychiatric hospitals, and I did my one of my 2 months rotations there. And the last one is nursing homes, and that's where I'm currently working at now, in a nursing home, which I've been working in a nursing home for a long time. So, but the biggest employer for occupational therapy assistant is the nursing home. They hire, most of assistants works in nursing homes. So that's a big employer for assistants. Nursing homes are. And what I would tell anybody, I wish someone told me this when I started out, I would recommend that you go to a hospital setting first, because when you go to the hospital, you can get trained in all different types of patients. Like in a hospital setting, they will have pediatric unit, then they got the adults, or it's like all different types of areas you can work in the hospital setting itself. Because I think some of them have like outpatient. Yeah, they have outpatient clinics too. Some hospitals do. But being in a hospital setting, you get to work with all different types of patients, with all different types of conditions, like strokes, hip replacement, knee replacement, any kind of neurological things, so that gives you a variety of types of patient that you can work with. And so I will always recommend, once you first get out of school, to go work in a hospital setting. When I first graduated from school, my first job I was doing pediatrics, and then I went into working full time. I had a part-time pediatric job, and then when I got a full-time job, it was in a nursing home setting. But I always worked in a nursing home. That was my desire, to be in a nursing home. So I'm okay with it, but I do recommend that you start out in a hospital setting just to get more training. Lucky, when I started, I had a wonderful OT that I worked under. She took me under her wing, and she just taught me everything that she can think of. And it really helped, really helped me when I first got out of school. And let's see what else I want to say. Yeah, nursing home is the biggest employer, and also, as an occupational therapy assistant, you make more money, I would say, in a nursing home setting versus all these other settings. I think the nursing home setting would pay a little bit more. I don't know. Sometimes home health may pay more, but it all depends how they're paying. If you do home health, normally they go to the houses and see the patients in their homes, with like elderly people in their homes, and what they will do, they'll probably get like maybe 2 or 3 visits a week. And most home health companies, they'll pay you per visit. So if you have 6 patients on your assignment, you'll get paid per visit. Each, like, if you see all 6 of those patients that day, then you'll get paid per visit for those 6 patients. But for some reason, what if someone cancels and you lose a patient? If you saw 5 out of those 6, then you're only going to get paid for 5 patients instead of 6. But they do pay you mileage. So that's with the home health. Now, sometimes I think some people said they may make a little bit more, but I don't think if they do as much. But I don't think that they can guarantee, because your hours may fluctuate more than what it does in a nursing home. And then too, with a nursing home, you make more, but sometimes too, it all depends on what the caseload look like in the facility for therapy. If there's a lot of patients on the therapy caseload at the time, then you probably can get 8 hours a day. If the caseload drops, then you might not get 8 hours a day and everything. But the good thing about that is you get paid when you clock in that morning. You're on the clock. It's not like you're getting paid per visit. You get paid from the moment you clock in, and they expect you to treat your patient, because you had to be meet a certain productivity standards by the end of the day. Like most nursing homes, I think right now, the productivity requirement for assistants is 90% and above. That means 90% of your day, of your 8-hour day, or how many hours you got, you should spend treating patients. That's what that means. So I'm trying to think what else I want to say about the practice areas. I've done some over the years. I've worked. I did like my training in hospitals, but I never worked as an employee in a hospital. But when I was in school, my rotations, when you're in school as an OTA, you have to do. I'm trying to think how many. I think we did 6 1-week clinical rotations. Then you do 2 2-month rotations. I think when you're doing your I can't remember, it's so long ago, but I think that's how it went. My first clinical rotation, I was in a hospital in Fayetteville, and I was there for 2 months. And then my last clinical rotation, I was in a psychiatric hospital in Goldsboro, North Carolina, and I was there for 2 months. So that's the only experience I have working in a hospital setting. I've done pediatric stuff. Like, I've mostly done early intervention with pediatrics, working with the babies from 0 to 3, and I really enjoy that. And like I said, most of my experience has been in the nursing home, working with the elderly patients. Now, with the nursing homes, we're going through a lot of changes too. From the time I started out, which was like 23 years ago, it's like reimbursement has changed, the way Medicare reimbursed the facility. When I first started out, they were changing the reimbursement. The way they were reimbursing the facilities for therapy was changing at the time. And so now we just went through another change, probably, I think it's been about 2 or 3 years in that, 2 or 3 years ago, which means that the facilities get paid based on their, like the condition of the patient, like their diagnosis and things like that. It's not necessarily the, oh no, my battery's running low. It's not necessarily the, usually back in the day, it used to be if a person needed therapy, they went to the nursing home, and the nursing home got reimbursed extra money based on that patient having a skilled need for therapy. Now, with the latest change with Medicare, what they're saying is they're telling the facilities, we're going to pay you regardless if they do therapy or not. But the reimbursement, I think they get more. It depends on like how sick the patient is. We're seeing a lot of our patients now, to me, seem like they're sicker. Like, you may have some people like have cancer and different little things like that, or like those high level, which we used to do a lot of hip and knee surgery. We still get those types of patients, but a lot of times they don't stay as long as they used to. Most time they're out within 20 days, 20 to 30 days of rehab, which, and really, really they are doing good enough where they can go home in that amount of time. It all depends on their weight-bearing status that they get from the doctor. Well, anyway, if anybody want to know more about that, just leave me a comment and I can try to elaborate more on that later. But it's so much I can tell you about the types of patients you'll get and reimbursement stuff with nursing home. Then they were asking about specialty areas. Let me tell you, some of the specialty areas was driving and community mobility, environmental modifications, feeding, eating, and swallowing, low vision, school systems, aquatic therapy, assistive technology, autism, brain injury, diabetes, driving and community mobility, environmental modification, which I already said that earlier, I think, gerontology, hand therapy, hippotherapy, low vision, lymphedema, mental health, neurodevelopmental treatment, pediatrics, physical rehabilitation, school systems, seating and mobility, stroke rehab, anxiety treatments, Alzheimer's treatment. There's a lot of different things that you can specialize in. I know years ago we used to do like a lot of exercise and stuff with patients. So one of my co-workers, we went to a course on strength training, and we were certified strength training specialists based on that course that we took that day. So it's pretty much whatever you have an interest in when you're working with patients. Like, I love working with stroke patients. They're my favorite type of patient to work with as far as rehabilitation, because I feel like I can do so much with them. So I really love working with stroke patients. So you can always go, whatever you have an interest in, you can go and find out as much information as you can about working with that type of patient. And there are some programs, stuff online or whatever you can get certified in. But there's a lot of different things that you can focus on, like feeding therapy. Some people go back and get certification in just feeding, working with assistant patient and feeding. Like, especially with children, there's a lot of courses that you can take on feeding therapy. Assistive technology, that's another course that you can take. I went back and got my graduate certification in assistive technology, because we give a lot of assistive devices out to patients and stuff, and then people are always asking about different types of tech devices that they can use at home and things like that. Mostly like low tech devices and things like that. Alzheimer's, I did a couple of courses on Alzheimer's. That's a really good thing to probably get certified in, because especially if you work in a nursing home, there's a lot of patients that have some type of dementia or Alzheimer's. So it's good to learn as much as you can about that type of that specific diagnosis. But it's like so many different things. Whatever you have an interest in, you can pretty much go online, take some courses, or find programs that offer certification that particular thing. A lot of time now, unfortunately, it doesn't mean that you will be able to make more money if you're working somewhere. It's not, a lot of companies won't pay you extra because you specialize in that. A lot of companies won't do that. But it's just good to know that to have someone that's available that's crafted in that skill level, or they can tell you more about that specific thing. So I think getting some kind of certification or going to courses on specific things is a good thing to do. I mean, over the years, I've taken a lot of different courses on stroke rehab, even hip and knee replacement, stuff like that. I've taken courses over that over the years. And low vision. Low vision is the one. I went to a course on that, too. That's a good specialty area, too. I've done some training in that. I mean, I just try to know a little bit about everything that I can think of, especially because we see all different types of patients in the facility that I work to. And then, too, when you're working with the elderly, they have, like, so many different diagnoses, so many limitations going on. So it's good to kind know a little bit about a lot of different types of things, you know. Because not only are they having weakness, but also they have low vision. They're weak, low vision. They have balance issues. They have cognitive issues. So it's good to know a little bit just about every different thing. So let me tell you about this. You also can go to what is called AOTA. That's the American Occupational Therapy Association. You can go on their website and they offer specialty or certification in certain areas for OT. And the AOTA, American Occupational Therapy Association, that's our national professional association that represents the interests of the therapists and the OT, the therapists and the students and the OTAs, just the OT profession. They represent us on a national level. Like anytime like laws and stuff that change and may affect the way we practice, AOTA was send they represent us. They send lobbyists to Congress to fight on our behalf with different things. Like right now, there's a reimbursement issue with occupational therapy assistant that was affecting nursing home. Like if you work with a patient that's a Part B, I think reimbursement is like the reimbursement for the assistant is less than what it is for the therapist. So I know that they've been lobbying on our behalf about that, getting those reimbursement changes changed to, you know, so it's, you know, so that it's like we're making the same amount of money, where there's no difference in the amount what we make, what they get reimbursed for assistant versus what they get reimbursed for a therapist. So I know they do a lot of different things, but the website, and also you can join the association once you finish school and stuff like that, or if you're a student, and it gives you like different courses and stuff that you can take just to get continuing education hours and stuff like that. And it's a good website. It give you like a lot of different information about OT and things that going on in the community and on national level too. So just know when you finish school, you have to take the state exam to get your license. So each year you have to. I know here in North Carolina we're required to have 15 hours of continuing education to renew our license. And that is, yeah, that's with the state of North Carolina. That's our state, the state licensing board. So with OT, we have a state licensing board, and then we have a national certification board. And you have to renew your certification every 3 years. See, I'm a occupational therapy assistant, but I'm a certified occupational therapy assistant. So I'm a COTA. You get to see if you keep your national certification. If you renew that every 3 years, so you get to keep your you get your C. So that's probably sound kind of crazy, but that's what it is. So you have a state licensure that you had to meet every year. Then you have a certification that you have to renew every 3 years. So with the state licensure, which you do yearly, you have to have 15 continuing education hours. And I think that license $50. Or did it go up to 65? I'm thinking it's still 50. I could be wrong. I think it's $50. I think it's 50 because I know we pay for the you pay for your licensure yearly, but then you do your certification every 3 years, and you have to have 36 continuing education hours for that every 3 years, and you can use the same licensure hours that you got from your state certification. You can use those hours also to put on for your renewal with your certification every 3 years. I think I know it is. The certification is $65 every 3 years, and then the state licensure is $50 every year. That's what it is. So those are two things that you have to remember that you have to stay up on. I'm trying to think some other things. I'm running a blank here, y'all. Oh, yeah, and autism, that's a big thing, too, when you're talking about certification. Because, you know, there's a lot of kids with autism, and that's another good certification to look into if you working with young children. because there's a lot of families who have children that are affected with autism, so it's good to have that certification too. I'm trying to think. I mean, there's just so many different things with this profession. It covers, like, it just gives you a good foundation to be able to do a lot of different things. That's one thing I like about occupational therapy, is because it's very holistic. It looks at the whole aspect of a person. You're gonna look at, you know, just their whole entire way of life. Like, if you get a patient, you got to think about what is that patient trying to do. Like, are they gonna be able to, or do they need to be independent to go home? Do they live by themselves? Do they have family member they have to take care of? You had to think about the whole aspect of that person's life whenever you working with that person. And so some things, like if you have a person with a hip replacement, so they need to learn how to take a bath, get dressed. They got to get strong enough so they can be able to stand and cook. They might live independently at home, so they need to be able to cook. You have to think about the fact that they need to be able to go out into the community. They need to be able to go out to the grocery store, do their grocery shopping. They need to be able to get in and out of the car. I mean, so many different things that you have to think about when you're working with the patient. And I just love the holistic approach from the professional OT. Or you got to think, do they like community recreation? Do they like to go to bingo? Do they like to go to the community center with their friends? Do they like to go out to eat with their friends? There's so many different things that it covers when you're working in OT. And that's one thing I like about it. It just gives you a good foundation for a lot of different things. So a lot of different professions too. I mean, one of my friends, she's an OTA like me, but she took a job in assistive technology. And she goes out and she evaluates people to see what type of assistive device that they need. And based on her having that background in OT, then she qualified for that job. Now, the only disadvantage that I don't like about being an assistant, I don't know if people talk about this as much, but the only thing that I don't like about it is the fact that I just feel like as an assistant, I feel like I'm just limited. Like I will always be an occupational therapy assistant. Not unless I want to go back to school and become an occupational therapist. But if I don't want to do that, then I'm always going to be just an occupational therapy assistant. Like, there is some companies that you can, I guess, take on like a manager role. There are some companies that hire OT assistant as managers and things like that. If you're not interested in that aspect of it, then you always have to look at the fact that you're an OT assistant, which I don't mind. I love what I do because, you know, as an assistant, we don't have as much paperwork as a therapist does. They have to do the evaluations. We treat the patient, we do a daily note, and that's it. And the therapist will see them every 10 days and do like a weekly note, you know, just to see where they at as far as their goals and things like that. So, I mean, it's so much, to me, it's easier. The paperwork is a lot easier, and the pay is pretty good. So, I think the next video I'll probably try to talk about, like, the pay, what you will make in certain areas. I mean, which would be hard because all I know is about the nursing home. Some pediatric stuff. It all depends. Well, y'all let me know if you want to know what you want to know more about the pay, how much do you make, or just leave me a comment about what you feel, what's the next thing you want me to do a video on. Because it's just so much I can talk about. It's kind of hard to kind of narrow it down. But anyway, I want to thank y'all for tuning in. If you like the video, click like and subscribe. Please subscribe and please click like. So the more you like it, the more they'll share the video on YouTube and more people get this information. So once again, thank you guys for tuning in. Good night.